I remember early on having patients coming in who were vulnerable. They had underlying medical conditions, but trying to support them and basically watching them progress to dying. And then when it was clear that they were dying, we could not allow family to come see them, so they were dying alone in their hospital room, and even without much staff going in due to concern about the infection. So it was it was very difficult. It created this feeling of helplessness where it was my job was to help and to provide care, but I was feeling helpless.
Caring for patients with COVID started off similar to working in the ICU, taking care of critical care patients. But the one of the biggest things that impacted, I think, most of us was the separation of families from the patients. I used to be a hospice nurse, so involving families in patient care was really important. So seeing that separation while patients were dying was difficult. Flying patients sometimes hundreds of miles away from their home just to find an open hospital bed where they'd be alone and not know anybody was difficult.
Medicine is good at teaching you how to do that, how to kind of ignore yourself and ignore your needs and what you're feeling and just keep coming into work to provide care. And I think over time, that really wears away at you and certainly wore away at me and I think contributed to what I experienced as burnout.
I think what led to demoralization was around the second wave in how the community started to react and how we went from heroes to now they're fighting with us because misinformation, some of it coming from the leaders of this country, and all of a sudden they're fighting us bedside, sometimes assaulting us, assaulting nurses, and all these things about requesting non-beneficial treatments that were just added a lot of hurt to families that were already losing their loved ones and now feeling because of the misinformation that we were standing in the way of their loved one getting a treatment that not only didn't stand to help them, but it would actually make things worse. So it created this breakdown in this clinician-patient relationship.
Caring for patients during that time was a different level of stress than I was used to in emergency medicine because people had very different symptoms. Initially, we weren't sure what was going on. And once we learned what was going on, we didn't feel like we had appropriate resources to take care of ourselves. And then I would see people who looked just like me dying and being scared every day when I went into work that I was going to die also.
There was this emotional exhaustion that I was experiencing. There was feeling a sense of helplessness, and like I went into medicine to be able to help people, and I was feeling like I wasn't able to do what I wanted to do. And I think also there's a kind of detachment, a loss of connection that you feel when you're feeling burned out. So it's a kind of a detachment from other people and detachment from your own feelings. In a way, you're kind of numbing yourself, and it's an unpleasant feeling, to go to work, but not to have that sense of connection with others and that sense of interest in your work.
One of my biggest, I guess, fears as a nurse during COVID was that I might have not done what the patient really needed. Like in the beginning, we didn't really know what the best treatments for COVID patients were as far as ventilator strategies and medication strategies. So I always had this fear that someday I would find out that, I actually was hurting patients when we thought we were helping them.
then all of a sudden, after this event, I find myself having to park in the hospital half an hour to 45 minutes to try to calm myself down before coming into work to do a work that I have done flawlessly for more than 2 decades. And all of a sudden, I'm in this state of anxiety and anticipatory doom about that, something is going to happen, that it was irrational. And I felt that maybe this was just I was kind of, it was time for me to leave medicine. I mean, I was at that point.
Initially, when people were really sick, they knew they were sick. When we knew what COVID was, and we would say to people, you're really sick, you're going to need to be intubated. It was almost like people sort of understood that. And there was a high degree of, I don't want to say fear, but like fear and respect from the community for what we were doing. You'd go home and all the pots and pans banging and the heroes, this sort of rhetoric. And then months later, it turned, and I don't know if it was media, social media, whenever the doubt started coming in, people were tired of being home, work, school, kids were at home. Then it turned to being abused by patients, being accused of falsifying positive tests because we were getting reimbursed and paid for them. Being a shill for the man in regards to vaccines and how we were just sheep. And it was, then it became abusive, and people would yell and scream at us and, accuse us of making things up. And right, we're coming off the heels of just trying not to die going into work.
It made me feel very grateful for my career and recognizing how important my career is and how important my service, the work that I do is. And then there's this deep compassion, connection that I feel, a much enhanced connection and compassion toward my patients and my colleagues and the staff. And then that trust that I experience is like I can go to work, and whatever happens, if it's another pandemic, whatever happens, whatever encounters I have, that I'm going to be able to manage it.
So I felt like the drug helps you access parts of yourself that are hard to access every day when what you're busy with is work and buying groceries and cleaning the house and, all the things that we spend all of our time thinking about. So psilocybin really helped shed all of that away and open you up to a deeper, more intimate, more accurate version of yourself.
It just seemed like the suffering was, I was creating the suffering that I was experiencing, and that the only thing I can do is continue to do my duty and serve the patients the best and that I can, and that letting myself be tied up in suffering that I created can only detract from the care that I provide to future patients. So it's not reasonable or helpful for me to dwell on any possible past suffering or errors.
Something that the psilocybin does is it creates an intense connection with your body. And the best way I can describe it is the work that I do now, my body feels calm and quiet. And when I was working in the emergency department, it didn't. It felt frantic. It felt discordant. It felt buzzy, I guess. And now it doesn't. It feels calm, really calm, like very deeply peaceful.
So I discovered this place of calmness and groundedness. And so I look for kind of the moving forward, not only at work, but at home, since I know that this exists, that this is possible. So I've been working towards as much as I can when I'm in the face of adversity or of uncertainty, of complexity, that I try to come in from that space.
The psilocybin study and the psilocybin medication helped me to feel more open and help me to forgive myself, and help me to accept myself and accept myself as a person and as a provider at the hospital. I think the the day that I took the drug was just a very um, like you're letting the emotions wash over you, and I think that that helps you to feel um, connection to self and helps you to feel gratitude about yourself and helps you to feel acceptance. So I felt a lot of deep acceptance of who I am and who I am as a provider,